All right, today we're putting on our detective hats to crack a medical case that honestly stumps a lot of doctors. We're talking about that mysterious and sometimes pretty painful snapping sound in your elbow. So, have you ever been working out, maybe doing some push ups, and you hear or even feel this weird snap coming from the inside of your elbow? It's way more common than you'd think, and figuring out the real cause, well, that's a fascinating little puzzle. Let's dive in. So, what exactly are we dealing with here? Let's start by looking at the number one clue in this whole investigation. The whole case revolves around this one symptom, the snap. Sometimes it hurts, sometimes you can actually hear it pop, and sometimes you can even see something shift under your skin. And it almost always happens when you bend your elbow, especially when you're lifting something. Now, who does this happen to? Well, the patient profile is pretty specific. Get this. A whopping 80% of cases are men. And it's super common in athletes. We're talking weightlifters, wrestlers, and also in laborers, mechanics, welders, people who are using their arms all day, every day. So when someone shows up with these symptoms, there's a usual suspect that doctors almost always look at first. But as you're about to see, this is where the plot really thickens. The prime suspect is almost always the ulnar nerve, your funny bone. An unstable ulnar nerve can totally snap over the bone and cause pain. And here's the problem. The symptoms, that pain, the snapping feeling, they match our mystery condition almost perfectly. This makes it an incredibly easy and very common misdiagnosis. And that leads us to this pretty shocking number, 44.2%. So what does that even mean? It means that in nearly half of the surgeries performed for this snapping elbow, the real cause was completely missed. Surgeons went in, operated on the ulnar nerve thinking that was the problem, but the snapping just kept happening. Why? Because they hadn't found the true culprit. Something else is clearly going on. So, if it's not the usual suspect, then what is it? It's time to unmask the real offender behind that frustrating snap. The real condition is called snapping triceps syndrome. You see, it's not the nerve that's the problem. It's actually a piece of the triceps muscle itself that's slipping out of place. As you bend your elbow, part of that muscle literally jumps over the bony bump on the inside of your elbow, and that's what creates that unmistakable snap. So, why does this happen? Well, it really just comes down to anatomy and physics, specifically something called the T angle. The triceps muscle has three parts, and they each pull in a slightly different direction. The T angle is just the combined line of pull for the whole muscle. If that angle is off, it can pull part of the muscle inward and cause it to slip. Right, so if that T angle is misaligned, the force yanks the triceps inward and, snap, it pops over the bone. This misalignment can be caused by two main things. Either the actual shape of your bones is a little different, or there are some variations in your soft tissues. And here are the two main bony culprits. On the left, we see something called a cubitus varus deformity. This often happens after a childhood fracture, where the arm is angled just slightly inward. That changes the T angle. And on the right, you can see that the medial epicondyle, that bony bump, is underdeveloped. It's just not big enough to act as a proper wall to keep the triceps in place. Okay, so now that we know the true cause, how did doctors avoid falling into that misdiagnosis trap? How do they crack this case correctly? Well, they need the right detective's toolkit. It always starts with a good dynamic physical exam, having the patient move their elbow around. But the real game changer, the MVP of this whole process is dynamic ultrasound. Unlike a static MRI, an ultrasound lets the doctor watch the muscle and nerve in real time as the elbow is bending. They can literally see the snap happen right there on the screen. So the case is cracked, we've got the right diagnosis. What's the plan? How do we fix this for good? The treatment plan is actually super logical. First, you confirm the exact cause. Is it bone or soft tissue? If it's a bone issue, like that varus deformity, surgeons can realign the bone. If it's a soft tissue problem, they can simply reposition that snapping part of the triceps. And this is so important. They test the elbow right there during the surgery to make absolutely sure the snapping is completely gone. And this brings us to the best part of the whole story, the result. When you make the correct diagnosis and perform the right surgery, the success rate is just incredible. Look at that. Nearly 98% of patients say their symptoms are completely resolved. The snapping is gone, the pain is gone. It works. So why did we just go so deep into this one very specific medical mystery?
Because honestly, it teaches us some really, really important lessons.
The big takeaway here is this. First, a snapping elbow isn't always what it seems. The obvious answer can be wrong. Second, that ulnar nerve is often just a red herring, distracting everyone from the real problem. It's a powerful reminder that truly understanding anatomy, like the T-angle, is everything. But most importantly for patients, getting the diagnosis right the first time prevents failed treatments and avoids the need for more surgeries down the road.
The case of the snapping elbow really shows how easily the true cause of something can be overlooked. And it leaves us with one last big thought. What other common problems have a hidden story? What other medical mysteries are out there just waiting to be solved, hiding in plain sight?